Okay, why don't we go ahead and get started? I've got a PowerPoint. We're going to do some polling questions, kind of get your perspective on some of the issues here. And we're going to discuss going to the ballot for single payer, really going to the state ballot for single payer, because we don't have that option nationally. So we're going to talk a little bit about the history and kind of start with where things stand in a few places, and then some ideas, do's and don'ts, some pitfalls, and discuss possible responses to industry arguments. And so really appreciate y'all joining. I'll go ahead and start the share a screen and the ballot and the PowerPoint. Get it the right view here. And what we're discussing is going to the ballot for state single payer. My name is Michael Lighty. I do some consulting for the National Union of Healthcare Workers and am president of Healthy California Now, statewide coalition for single payer in California. Just a little background on me. I was an activist in the 1994 Prop 186 campaign, which was the last time that I think the one and only time the single payer was on the ballot in California. When I was at the California Nurses Association in 1996, I coordinated a ballot initiative that we did called Prop 216, which was an HMO reform initiative, many of the provisions of which, including the landmark law that established limits on the number of patients each nurse could take care of, the nurse to patient ratio law, came out of that campaign. We eventually passed that law in 1999. I was the campaign manager for the 2006 Prop 206 campaign to limit corporate money in elections and initiatives. And that was based upon the idea that it was going to be very difficult to win an initiative if the industry could spend unlimited amounts of money. So we tried to unsuccessfully tried to limit the corporate campaign spending. I also did some work with the Universal Healthcare Initiative campaign in Colorado in 2016. And I've been doing this work, God, I guess it's over 30 years now. So I do have some background in the initiative process. I want to thank One Payer States for giving this initiative, kind of state initiative, lay of the land. Before we start, I wondered if we could just take a poll of folks in the room, as it were, whether you or other activists in your state are planning to do a single payer initiative in the next 1 to 4 years. So if you could go ahead and fill out that poll. All right, we're running neck and neck. Okay. All right. All right, we have most people have participated. And let's literally it's 50-50. And that's great, because I think I really appreciate the opportunity to talk to folks who are considering this. So I think that's a good sign for our discussion today. So here's an overview from One Payer States about where a state single payer. Okay, we did share these results, so just make sure everyone sees it. 50-50, literally. It's fantastic. And we will just move on. The state-based single payer activity, you can see from this slide that a number of states have current bills. Really, it's over 10 states have current bills. The California bill isn't current, but it is obviously still something that's planning to go forward. The other states listed have what we're abbreviating as state-based universal healthcare infrastructure. And those include Colorado, Hawaii, Iowa, Maryland, Pennsylvania, Vermont, and Virginia. So it's a pretty representative group of states, including some very large states. And that, I think, matters because our experience has been that it's been difficult, in particularly when we went through the effort in Vermont, to find a viable path for a smaller state to do it. And so it's significant that large states have infrastructure and, in many cases, active legislation. The theory behind state-based single payer, from my point of view, is that it provides the basis to prove that it works and provides the political momentum, particularly in a large state like California, New York, or a set of states like Washington, Oregon, California, Minnesota, New York, or even in a state that has a history of innovative policy, such as Maine, which has done clean elections. That political momentum matters. And there are certainly barriers in terms of policy and law to enacting single payer, but those barriers can be overcome. And you can't deny the fact that, as former Governor Shumlin from Vermont said, if California does single payer, it puts maximum pressure on the Democrats in Congress to follow suit. And literally, if we can do it in California, we can do it around the country. And I'm sure others, like in New York and other states, may feel the same. So that's really why this is so important. There's been some discussion about how state single payer may leap behind other states or privilege some states or other. But the whole point of doing it in the states is to win it nationally. And it's a strategic approach based upon how we can create the political momentum for guaranteed health care and Medicare for all at the national level. And so I think it's always important to understand that. Some key areas of state-based universal healthcare activity: Maine and Washington are developing ballot initiatives. As we know, we'll talk a little bit further in the Colorado is the most recent one that was not successful. But Massachusetts is running several non-binding ballot campaigns, educational mobilization efforts, not legislative. They're not going to enact single payer, but it is a great tactic to put pressure on the representatives in those areas that could sign on to the state bill but haven't, demonstrate public opinion, and build infrastructure for a legislative or ballot campaign. There's also developing interest in a regional approach in Washington, Oregon, California, and Hawaii. And there is discussions among mid-Atlantic states about coordinating COVID recovery, and that coalition is active and may be a basis for the kind of regional approach that could be successful. So many have suggested that if we do initiatives in a number of states at once, it makes it difficult for the industry to focus their resources on one state. I think there's an argument there. I'm going to have a slightly different take on it later on in the workshop in terms of the importance of California. But I do think it's important not to underestimate how much resources are at the industry's disposal. And it's not clear that even scaling a half dozen or a dozen states would significantly dilute their ability to spend what it takes to defeat initiatives that weren't well prepared and well funded. So I think that the idea that we can simply overwhelm the resources of the industry may not be likely. So we should just keep that in mind. The attractions of a ballot initiative, I think we know this, that really the legislative process is compromised in many respects. It obviously is corrupted by the industry money that goes to electing representatives and also lobbying them when it comes time to consider legislation. And I think many of us have had that experience. And so the avoiding that corruption and compromise is the real attraction of ballot initiatives, and empowers those most affected to make the policy choice. In other words, we can, as advocates and people directly affected by the healthcare industry and its denials of care and high costs and profit making, it can provide us with maximum control over policy and message. And that is very attractive. It depends, of course, maximum control over the message and policy that a substantial coalition will support. That's the caveat we can get into. And obviously, it gets media attention, it increases supporters, builds infrastructure, raises visibility. These are real attractions for a ballot initiative, particularly when folks are frustrated by the legislative process that has not been successful. So but I think the key question here is, how do we decide to pursue a ballot initiative? We kind of take that for granted. It's like, oh, well, the legislation hasn't worked, or we've tried a few times, so we're going to go to the ballot. But who decides? So I'm asking a poll question just to get your perspectives on that. Should it be a volunteer organizing group, a statewide coalition of representative groups, an individual organization with the resources to fund the campaign, a deep pocket? Or should this really be a national strategic question for our movement? So I'm very interested in your responses. I think there's an assumption made that there's just, it's just going to happen, or there's going to be somehow a set of individuals or organization that does it. But I think it's important to actively consider who is in the best position to move it. And also, I would suggest that the state initiatives are not islands. We have many times in California, as we've tried to move single payer forward legislatively since 2014, when Vermont's effort failed, we hear over and over again that the Vermont failure is the template for why we can't do it in California. When we talk about popular support, we're often reminded of the results, even going back to 186 in 1994 in California that didn't do well, or we're reminded of the Colorado. So we have to understand that state initiatives impact the movement as a whole and have national implications. So like folks have answered, so we'll just give you a couple more seconds to weigh in. All right. Pretty high response rate, 85% participation, sharing the results. So pretty even split. I think it's significant that there's large support for a national coalition of single payer movement organizations making the decision. But there's also, of course, 50% support for a statewide coalition of representative groups. This is very significant. I think this is a smart strategic assessment on the group's part, that really this has got to be a broad organizational decision. And that's significant, because when you are evaluating doing an initiative campaign, considering doing an initiative campaign at the beginning of one, this is very instructive, that if we can build a representative coalition and we can get the support of national movement organizations devoted to single payer, that is going to increase the likelihood of our success. So I think that's a very significant result, because it reflects, I think, some very solid strategic thinking. So this history of single payer ballot initiatives it did meet some of those criteria. When we did Prop 186 in California, that was a coalition, representative coalition that had put that together. And it was in the context of the Clinton plan, which we had expected to actually get enacted. And then this would be the next step in that evolution. So it anticipated that there was a national environment positive for reform. That turned out not to be the case. And one of the reasons it went down significantly was that context had changed significantly. So it did lose by 20, it got 27% support, really lost almost 3-1. And it 1.5 million signatures to put it on the ballot, but it did not have the resources beyond about $900,000 to spend on advertising. And the primary tactic of support was house parties. When I say unusual suspects, what I'm talking about here is a defining constituency that really made that really enhanced the legitimacy of the initiative. And registered nurses were spokespeople for the campaign and a very significant part of it. And so that was a decisive constituency of support. But the industry overwhelmed it with their own lies and ads. The national environment turned against healthcare reform, and most of the resources for the campaign went into getting it on the ballot. And it was not there was not the scale of the campaign in the fall necessary to win. In Oregon, in 2002, there was a general election campaign, and for Proposition 23, the legislature had referred to the ballot. It also collected 98,000 signatures, got about 21.5% support. But here, this was a severely underfunded campaign. Now, it's significant that the AFL-CIO supported it. And but if you look at those numbers, spent $55,000 to qualify, $35,000 on the general election, there is no way that that is going to be within the realm of victory. And it did ultimately have support from a significant coalition, but it did not obviously coalesce into something that could really be viable. And so it lost by almost 4-1 in the case of Oregon. The environment in Colorado in 2016 was not so favorable, and it also lost almost 4-1. Again, the money and the effort was put into putting it on the ballot, 900,000. Most of that was spent to qualify, and there was canvassing that was done, but it turned out that NARAL was a leading opponent, arguing that, well, if we went to a publicly funded system, this would jeopardize the right to reproductive freedom and justice and restrict access to choice. That was a pretty disingenuous argument ultimately, because the initiative really didn't do that, but it reflected the politics of the Clinton campaign, because this took place in the context of initially the primary fight between Bernie Sanders and Hillary Clinton, and the Clintonites really lined up against this initiative. But a similar pattern in all three, I think, is clear, that there was insufficient money to compete in the general election. There was some opposition that was particularly divisive, and there wasn't the sufficiently robust campaign to overcome that. And those ballot initiatives should provide lessons for us going forward. Some suggestions on what to avoid, what to prepare for, what to do. And ask kind of your perspective on what indicators of support do you consider essential to the success of a ballot initiative? What really is going to propel it forward? A strong grassroots demand, a broad coalition of labor community groups, sufficient resources to mount a media campaign. What do you think is most decisive there? Really essential. I think what's consistent in the ones that we looked at, California, Oregon, and Colorado, is that there was a strong grassroots demand. And really, that's what the qualifying of the initiatives reflects, is a very strong grassroots base. that we should take heart by, that really be heartened by. And at the same time, it's clear that that was not sufficient. And so what the question really for us is, what else is it going to take? All right, we have good participation here. Last, we're going to share results. So strong grassroots demand, but strong majority of folks feel that a broad coalition of labor and community groups is the essential element of success for a ballot initiative campaign. One could add for a legislative campaign as well. And I think I think we should talk maybe some more about the sufficient resources to mount a media campaign, because I don't think that should be emphasized. That really, particularly in a media-driven state like California, that has got to be a huge part of the campaign, in my view. So here's some suggestions on what to avoid. And again, it derives from the lessons of the current or the past initiative campaigns and how it may be applied currently. Spending all resources to qualify is very unlikely to work. There's this assumption, and I've heard it from folks, that the issue is so overwhelmingly popular, and it does. Let's face it, it polls very well. In California, maybe upwards of 70% in some polls, 65%, and in fact, among Democrats, it can be as high as 80%. And so the idea is, well, hey, it's so popular. If we get it on the ballot, it will just win. And it turns out that the ballot campaign is unpredictable as to what will be the issues at stake and presented before the voters. If the issues are our frame, well, sure, it's very, it's just a question of the cost savings and the advantages of a single payer system and guaranteeing health care and addressing equity. Yeah, but if we don't have the resources and the coalition to get that message out, and the other side has substantial ability to get their message out, then the initiative campaign is not just about the popularity of Medicare for all. It's really about what they define it to be. And so we can't assume that just getting it on the ballot is going to make it win. I have put out there that I think we need $5 million in the bank to start a campaign. Some folks think that that's unrealistic or inappropriate, but honestly, think about what it takes to actually build a coalition and conduct even if you don't spend a lot of money on TV, conduct the mail campaign, the voter canvass, all the materials, just the visibility presence and the organizing presence, getting the voter files and carrying out a voter ID campaign and turning out our voters who get out to vote. This is expensive stuff. And in some states, you could spend all that $5 million just on that before you get to a media budget. But it's important, as we saw in these other examples, Colorado didn't really have a media budget. Oregon didn't really have a media budget. And the one in California was a fraction of what it takes. So we have to understand that as hard as it is to recognize, having sufficient resources is essential. We've got to avoid a small group drafting the initiative. I think there's recognition among this group that that's the case, that a lack of adequate money and campaign workers is going to doom us. And in some ways, the Oregon experience was as much about the lack of robust campaign workers as it was anything else. And opposition from natural allies will be fatal. Any split is fatal. And that's really going to very likely be the opposition strategy. They're going to pick off elements of the healthcare system that would seem sympathetic to our demand for what they would call universal healthcare, but because the initiative is flawed, and that's the famous argument, the fatal flaw. Of course, we support the goals, but this version isn't going to work. And so they'll pick off community clinics, say, or they'll put out nurses who are really administrators and bosses, and they'll pretend. That's what we've seen in a number of cases. Certainly saw it in Colorado. We saw it in California. Oh, well, nurses don't really support this, and use that constituency, which is actually overwhelmingly in favor of single payer guaranteed healthcare, against it. And so any actual split like NARAL in Colorado, that's actually, people would perceive that as a natural ally for the demand for universal healthcare. That split can be fatal. Keep in mind that many voters just react to the ballot title and summary. And if it's a long, complex initiative that is going to not be described favorably, and that was, raise taxes, double the state budget to provide health care, provide government-run health care. Well, things, that can be tough when you get a ballot title like that. And if it's a 400-page initiative, it's inevitable that the opposition will pick out a phrase or a clause and turn that into a big lie that can be fatal. We have to make sure that the campaign material reaches a broad group of voters, not just a small number of voters. And we have to understand where the key voters are. So in obviously a place like Washington State, you're going to have to win in Seattle big. In a place like California, you're going to have to win LA County. In Oregon, Portland and Eugene are going to have to carry it forward. In Colorado, obviously Denver and Boulder are going to be key. So we have to be able to understand where the voters are and how to reach them. If we only do last minute TV, we're not going to win. In a state like California, it's probably true of other states as well. And that means, again, that goes back to the resource questions. If we're basically have a limited budget that we can only spend in the last 2 weeks of the campaign, particularly when early voting starts 30 days before Election Day, we are not going to win, and we might lose badly. Bringing in allies too late is a fatal flaw. I think we've all recognized that. You got to build that broad coalition from the beginning. And wishful thinking. Well, we got to avoid this, the magical thinking that because we are on the right side of history, because our reform is so overwhelmingly popular, the people will vote for it. And our experience is, sadly, that that's not the case, and that it's not really a case if you build it, they will come. We're only going to achieve here what we organize for, and what we organize for strategically. So how about on the positive side? I think we recognize this. Start early and build a social justice coalition with labor there. Labor, because these are organizations with resources whose members are deeply invested in health benefits. That's a big part of why they're in a union. And also, we've got a new, I think, realization as a result of the pandemic that fundamental inequities rooted in race and class and gender, and also sexual orientation, drive the experience of many in the healthcare system in a very negative way. And we can build upon those experiences and the organizations that are committed to addressing those issues and those disparities and equities, and create really that broad social justice coalition that can win. Better off being simple, specific, and short. The recent report from the Healthy California for All Commission in draft form suggested a couple dozen things that an initiative would have to address in order for single payer to be implemented in California. So you kind of start with a long list of things that are necessary to do. And then, of course, the actual design of the program and the financing. So it's a real challenge to get it to a point where you can actually create a specific and relatively brief initiative. I'm in favor of defining the universe, a winning universe of likely yes voters. Okay, we know it's broadly popular, but who are really the hardcore supporters? Like in a union organizing, who are ones who will not be moved? Who are the twos who are strong, but we need to reinforce them? Who are the threes that are in the middle that we can push to our side and keep there? Right? And the fours and fives, we're certainly not going to deal with the people who are fundamentally opposed to us. And the fours, we just may not have the resources. But if the polling is right, and there's a clear majority of those folks who are strongly with us, likely with us, and enough of the people in the middle we can pull over, that's a winning majority if we can identify, and I do favor using polling, surveys, and focus groups to shape the message that can hold and motivate yes voters. Because the whole problem is these initiatives start with 60% support. And by the time the vote happens, it's down to 27% or 20%. So we haven't waged a campaign that can hold our likely yes voters. And so we've got to be able to do that. And that means, it does mean being present on TV. It does mean raising sufficient money to do that. But at the same time, we can't do that without this incredible volunteer base. And you saw that in California. The nurses did an amazing job organizing the base of supporters for single payer. And it was really one of the strongest grassroots campaigns I think we've seen in a long time. And certainly the legislators felt the heat. That base is the key to a successful initiative strategy. And with that base has been enhanced as a result of the Bernie campaign, in particular in 2016 and 2020. And so, yeah, we're going to have to do real voter contact through all the digital tools that we have now. And also, there's no replacement for door-to-door canvas and phone banking and text. The most effective communication, as we all know, is personal, one-on-one. And as much as we've relied upon digital communications, there's nothing more effective than talking to a voter face-to-face and utilizing that huge grassroots base that we have. And that phoning is the second most effective. Text generally can get people who are with us, but we're going to have to do some level of inoculation and persuasion, and that is best done in person. Really, one of the lessons we learned from historically successful campaigns in California is to vilify the opposition. And one of the great examples of participatory democracy, of course, is the Prop 103 campaign in California, which fundamentally reformed auto insurance rates and was a very successful campaign on a grassroots basis with a pretty limited budget, certainly relative to the industry. And they had put competing initiatives on the ballot, which is a very typical strategy that the industry does. And yet, through a relentless campaign of earned media, daily hits on the insurance industry, it was very successful. And it put consumers, and it tapped into that outrage. And we're going to have to do the same, because as popular as our reform is, you still get these statistics that 70% of people like their insurance. But we've got to tap into the fact that when they actually try to use it, they hate it. And they're really not enamored with their insurance. They're really more likely to be supportive of their doctors, providers, nurses, and where they get their care. So that takes some messaging, which is why we have to devote some work to studying that and strategically and what that message is. And also, it takes creativity and the ability to carry out actions that are going to get media attention. And often those are more authentic than the kind of canned ads that you see. But it's important to use the general view that the acceptance really among the broad public that there's a problem with the status quo, that you've got 2/3 of people thinking that we need a fundamental change in our healthcare system. They may be satisfied with their insurance plan because they haven't used it much, but they know fundamentally healthcare is broken in this country. And so that is what we have I think that is what we have to do. And someone in the chat points out we need multilingual messaging. Absolutely. Given the diverse electorate that is on our side to start with, we've got to be able to speak to them in their own language and on the issues that most motivate them. And that's going to require a multilingual, multicultural program. And I think we do need to foreground the public health crisis of not only state-sanctioned violence, but also the pandemic and the environment and the climate emergency. That how can we possibly address the issues that face us in terms of behavioral health, long-term care, the mental health crisis from the pandemic, the fundamental disparities in ability to get care we need, the huge disparities revealed by COVID in the availability of services in frontline communities of color, and how can we address fully the crisis of the unhoused unless we have a robust healthcare system, not only to address mental health and addiction that may drive to some extent the fact that people lose their homes, but also the medical debt, the huge medical debt that is at the root of a majority of personal bankruptcies. If you go bankrupt, it's very tough to pay the rent and you often lose your mortgage. So let's understand the intersectional relationships of these issues on people's ability to get the healthcare they need. I think one of the most important thing is inoculation and persistence. And that's why the run up to the campaign is as important as the campaign. We're going to win a ballot initiative, probably even not just weeks, but probably months before the vote, because we will have inoculated voters against the industry argument. We'll have created infrastructure that can reach voters in crucial areas, and we'll have created a media narrative that's favorable to us. And delivering that inoculation is a multi-year process. And if we wait and just collect the signatures and try to wage a ballot campaign within a few months, it's very unlikely to do what we need to do. So somehow I got, we already did this poll, so we will not do that. So I want to suggest a proposal in light of what I've said, that since we know that California cannot win single payer without a ballot initiative, that we cannot implement single payer without it going to the ballot, can advocates agree nationally and regionally on a strategic focus to assist that passage before pursuing other state initiatives? Can we say that if California does it, then we can do it in our states and we can eventually do it federally? And we know that California is going to have to pass a ballot initiative. So let's figure out how best to assist that. Now, the timeline for California is, in my view, it's too risky to go to the ballot without securing the federal waiver, because you could end up with a ballot proposal that's passed and the feds could say, no, we're not really going to sign off on that. No, that's really not the level of funding we're going to do. And so either we're going to have to go back to the ballot or be explicit that the whole thing is contingent on getting that federal approval. And that's not a winning approach. So it's fundamental to understand, and that's true for other states as well, unless we can secure the federal waiver up front, the ballot initiative is a risky proposal, since it is unlikely to be implemented as passed by the voters if it does. What we, and I think AB 1400 smartly reflected this, that it ideally passes the legislature, and even ideally would put it on the ballot. Okay, we can't get 2/3 support in the legislature for the financing, but they can put it on the ballot. And that gives us the opportunity to do the inoculation and the political education and build the political infrastructure through that legislative campaign to that then carry over into a ballot initiative. Or, of course, we can gather signatures, which again takes a broad grassroots effort, but cannot be the whole focus of the campaign. So the best way to avoid that being the focus of the campaign is not to have to do it. and also demonstrate the political support that comes from the legislature. What are the key things that the opposition does in some of these initiatives? We saw it in the effort to limit prescription drug prices in California, is they'll use editorials against us. And so they'll have this a montage of all the newspapers that oppose this initiative. We've got to be in a position, and one of the best ways to do that is successfully move it through the legislature, that we pick off editorial boards. And we saw that. I think the Sacramento Bee supported AB 1400 in California. So the LA Times, I think, was favorable. So if we can pick off editorial boards, that gives it a huge legitimacy. And one way to do that is to get it through the legislature. In California, probably the earliest we could get to the ballot is 2024. That would take real pressure, I think, on the Newsom administration to move the federal waiver, pressure on the legislature to pass it and put it forward. But that timeline is possible in a very aggressive campaign. And I would argue strategically that this is the most effective way, if you're committed to winning it in your state, to win it in California first and help California do that. On the other hand, if we're in a situation where smaller states go forward first, that's going to undermine perhaps the ability in California to win. We got to have a clear message. This is one stab at it. We care, they scare. Better healthcare, not bigger profits, because that's all their campaign comes down to, are scare tactics. Let's face it, that they have the ability to try to shape the media message in a fear-based way, and fear works. And you talk to political consultants, talk to voters. Yeah, there's a real aversion to giving up something that they have in favor of an unproven alternative, or an alternative that sounds good, but well, is it really going to happen? Is it going to happen the way you say it is? And particularly, you got union members who have worked hard for their health benefits. They don't necessarily want to give that up unless they're convinced it's going to be substantially better and it's going to actually happen. And so we have to overcome that fear. And that is, again, probably a multi-year process but we also have to call out their scare tactics and understand that there are fundamental aspects of the healthcare system that that can't be solved by the present commercial insurance profit-making approach. And fundamentally, we have to lead with the message that it saves lives and money, hundreds of billions of dollars in the case of California. Turn the whole media frame around. It can't just be about, oh, it costs money, it's going to raise taxes. No, the whole point is it saves money. And in the context of inflation, this is the best way to actually reduce the cost of something significant, something that's a fifth of the economy. And that is huge to folks. Imagine individual Californians, according to this one calculation of the Healthy California for All Commission, it can save every adult and child in California $8,000 to $12,000 a year by the year 2031. How else? What is as effective as putting money in people's pockets as saving on healthcare by eliminating the commercial insurance and all the administrative waste and profit making in the current system, and doing all that and winning long-term care, winning real mental health parity and benefits, ending all the out-of-pocket costs under Medicare, and providing dental, hearing, and vision. We have an extraordinary case to make, but we got to be prepared for the opposition arguments that we saw this in California, that upend the coverage expansions of the Affordable Care Act. Literally, there are industry groups saying this single payer is too risky because we've got to build on what works, the ACA. And if the insurance industry is saying that, the ACA is very, very good for them. They said they're going to double the state budget. So then they just said, when it came to the financing for AB 1400, it's going to double income taxes. Well, that's just a load of crap, but it got all over the country. It's going to double income taxes. If we don't frame it as and a way to save money, we are going to be on the other side of that argument in a losing way. If it's all about taxes and costs, that's not terrain that we can win on. They talk about undermining competition and patient choice, which is a real laugher since the insurance companies don't give us much choice at all. And in most cases, the employer chooses the plans, or if there's a choice, it's one or two. But they will relentlessly hammer on choice. They're going to force you to give up your private insurance. You should have a choice of insurance plans. I think they're vulnerable on that question because I don't think people really like their insurance plans. Or if they like them, it's, as I said earlier, it's because they don't use them. But that's what they say. I mentioned it before, Vermont failed, so that's it, right? The government takeover of healthcare, it turns out, this polling that was done among Californians making 250% or less, 250% of federal poverty or less, actually by 2/3 favored a single government plan. That was the language, a single government plan. It's not clear this argument has the same saliency among our base and among our likely voters. We did hear this argument in Colorado, jeopardize abortion funding. It's not an issue in most of the blue states, if not all the blue states. But really what's jeopardizing access to reproductive rights and reproductive health services is the present system, which makes it dependent on essentially the Supreme Court and the religious power of the religious right in key states. And so this is actually the way to enshrine and guarantee access to comprehensive reproductive health benefits. We hear this often, Medicare is going bankrupt. Oh, it's not going to have enough money to sustain itself. And the fatal flaw one, we sometimes hear about the residency issue. Oh, the people are going to flock here and so forth. One of the key things happening in California is that they are going to provide publicly funded health benefits to undocumented folks through the California Medi-Cal Medicaid program. That's a huge benefit to us. So we don't have to fight this question over guaranteed universal health care on the issue of immigration. But you always got that fear factor that will be used, like, oh, people will pour across the border for health care. Obviously one that can be easily addressed, but is out there. And probably the biggest thing we saw, and we saw this during the AB 1400 fight recently in California, too risky, too uncertain, and literally unaffordable, which is, again, a laugher, considering that the present system will cost, by one estimate, nearly $500 billion more by 2031. That is, have cost over the next 10 years, $500 billion more, without covering everybody. And you even get the argument that it's too generous, right? That people, they're going to use too much healthcare. It's going to, unlimited services. I don't know. I think in this climate, not a particularly effective argument. So, but these are the things we have to prepare to address. And again, it goes back to how have you built the coalition? How have we prepared and inoculated voters? What's the broad reach of our campaign? What's our inoculation and political strategy so that a year out, we have the prospect of prevailing? So lots of ways to respond to these. Obviously, we can take different approaches. Talk about expanding the gains of the ACA by eliminating out-of-pocket expenses and narrow networks, that these are things that the present system has created that cannot be solved by the present system. The biggest response we have to make is that it saves workers, businesses, and taxpayers billions, hundreds of billions of dollars. It's going to provide real cost control, and the benefits are more comprehensive, and that it's not simply a question of continuing what we have, but actually expanding and improving. So the sense of peace of mind and security that comes from saving lives and money is ultimately incalculable and very much on our side. So that is kind of a rundown of what I wanted to present. And wanted to provide some opportunity for discussion since I've gone on and on here. And, people can put questions in the chat. And also, I don't know, I think everyone has been muted by the technical, by our host. But if people want to use, yes, raise hand function, we can call on folks and unmute. Does anyone have a comment or a question? All right, Mark.
Hi.
There you go. Hey.
Thanks, Michael. This is for your really clear-headed analysis here. I think this was really, really powerful. Gives you a lot to think about. I always like to use my experiences in the hard knock school of union organizing to think about these kind of things, because you're facing very, very similar challenges, where you're going to have like a united front of corporate power against you. I think, the 2 points that you made that really make a lot of sense to me is, number one, you're never going to be stronger than the day before you file for election. And once you get into that fight, you're only, now you're trying to hold on to your majority. And so, you have to be very careful not to believe that all of those folks are going to stick with you over that period of time. And secondarily, how important inoculation is to holding that majority together and preparing people for the vicious, dirty attacks that are going to be coming after them. They need to be prepared in advance. And then, the other thing that I think is really important, and we often forget about it because of the wishful thinking factor, is the importance of benchmarks. If you say you need 5 million in the bank to start this process, if you have 3 million in the bank, you don't start the process. You've got to reconfigure what, maybe it's going to be another year before you can hold this election in your state or whatever. But, you need to come together around clear benchmarks of where you need to be at various stages of the campaign, and then take a hard-headed assessment of whether you've met those benchmarks before you proceed. I think that's so, and that's really hard to do because, you just want to keep moving forward. But, you learn after a few getting your butts kicked in union elections. I've certainly learned that you can't just wish your way around those kind of barriers. So thanks again. I thought this was a really great and thoughtful approach.
All right, thank you so much, Mark. And the hardest thing about benchmarks is if you don't meet them, pulling the plug, right? And so then you're like, God, I don't want to set up benchmarks because then I the whole project is, in jeopardy. But the truth is, if we're not in a strong position a year out, 6 months out, well, chances are, as you say, very likely it's not going to get better. So let's be very clear and strategic about what it takes to win. And if we're not going to win, let's not be afraid to pull back and live to fight another day. I want to answer the question in the chat that Patty Harvey raised, and also Shirley Toy. You cannot secure a federal waiver without a formal application, which requires, in the simplest way, a legislative enactment of a program that the federal government can approve. Now, can a governor initiate waiver discussions that will help inform what ultimately the legislature passes? Yes, it can. Yes, he or she can. Can those discussions lead to a pretty substantial understanding of what it would take to get federal approval? Yes, it can. And for states that don't have a governor who's sympathetic to pursuing a waiver, then that requires a whole other political process even to get to the ballot, because you're going to have a very tough time getting getting voters to agree to something that may not happen, as I said earlier. So we're going to have to get a waiver application filed and approved in order to implement single payer at the state level. How we do that, maybe it takes the form of an authorization. Here are the points. Here's the program we want to negotiate with the federal government. Could be fully developed in a complete systems design. It could be a set of principles. Those are things that the agency, the federal agency, HHS, could elucidate and say, yeah, this is adequate to us. We'll consider this, go back and get authorization for it. So it's a somewhat dynamic process, but ultimately it's going to require legislative approval to actually submit a formal waiver application. My view has been that the governor can lead on that to engage with the feds and set up the favorable conditions for securing that legislative approval. Cindy?
So I want to give a couple examples here in California, just around the magnitude of this initiative process. And recently we had Prop 22 on the ballot, which was, Ubers and Lyft, and they led this, but they spent over $22 million to defeat what was a right to organizing bill, Assembly Bill 5 here in California. And so please just not forget that they will spend everything to fight us. And on the flip side of that, I want to say there was Prop 32 here around funding in our state a few years ago, in which all the unions came together. And we were able to beat the bad guys. So I think the lesson that I got, Michael, and what resonates with me is, one, people say, well, how much money will they spend? And it's like, all of it. They will spend all of it. And we have to be adequately prepared for that. And secondarily, when we have solidarity, right, when we have built a strong coalition, when we let others, in to really provide full input on what the strategy, the bill, the whole overall strategy of the campaign, then we can win. And we have examples of both in our state. So thanks very much for reminding us of those things.
That's great, Cindy. Those are great concrete examples of how actually what it takes to win. Thank you. Debbie?
I was wondering if you have a version of of the presentation you just did that is easy to share, because over and over again, I feel like new single payer activists in particular get really excited by the idea that, oh, well, Medicare for all is too hard, so we'll just do it in the state and it'll just be so easy because we want it to happen, and everybody will just see that. And I kind of want something that, I tried make some of the same points that you make, but I think you have more authority than I do. And if I could have, and you also have more detail and a full formal presentation, and I would just love to be able to show that to new single payer activists.
Yeah, I can do a PDF version of this, so it's more accessible, right? Because PowerPoint sometimes people can't use. So let me just put my email in the chat, and just send a request for it. I think that'd be the best. That would be the best way to get it out, is in PDF form. And I really appreciate the enthusiasm, particularly of new activists. We did this panel earlier in the week on young workers, and I got to tell you, I was inspired. There's a real level of enthusiasm and commitment among younger activists that is huge inspiration for me, and I think really kind of the future of our movement. So we've got to make sure that we do as much as we can to direct that in a strategic way. so that there's not disappointments that diffuse the enthusiasm and then just result in people walking away, but engage them in a strategic way that can win, right? That's what's going to do, that's what's going to do them the best, I think, and do us the best. Patty?
I just wanted to comment about the vote that we took about people seem to broadly agree that grassroots involvement and with unions are essential to get this program passed. And it occurs to me that to do that, of course, public education is so important, and a really pretty easy way to accomplish at least part of that goal is through simply responding to what's going on the ground now. For example, there was just a Sacramento Bee article about the teachers union in Sacramento, which had been striking, I think, for a week. And the union was paying, what, $35,000 per employee for health insurance. So they were saying, well, we're already spending so much, so you want to raise, we're going to transfer you all from, what was it, All Point to Kaiser. And that way we can save enough money and maybe give you a little wee bit of a raise. Well, think of how much more of a chance for a raise there would be if they didn't have to provide the health insurance at all. And so my point is that responding to this kind of event, which is current and on people's mind, is to send in an op-ed, send in a letter to the editor, and thousands of people will read it. And that is plants seeds that can sprout later with further waterings that we do. That's just the comment I wanted to make.
That's great, Patty. Thank you. And Cindy Young has really followed and is expert in these health benefits among the education in the education sector and the issues that the education unions are dealing with. And I think it's exactly the right entree to talk about how, in fact, often we argue that the people who have the most at stake in doing, guaranteed healthcare through single payer are parents, teachers, and students, because the money saved is going to benefit education almost more than any other sector. And that we're, all the kind of, resources that are constraining education at the district level in particular would be hugely resolved by lower healthcare costs. And Cindy's got a lot of great information on that. All right, Bob.
Okay, I'm muted. Yeah, I have a couple of comments I'd like to hear your comments on. I mean, you mentioned like the Bernie campaigns. And one of the things that my personal observation is Bernie 2016 was much more movement building. Bernie 2020 was much more a campaign. And I think we saw that. I think we saw a lot of people come out and become more active and do things after 2016 and not so much of 2020. And so I think, it's surprising, the latest California initiative we had, when we started up again, I was surprised to see so many groups had just abandoned their work after the previous SB 562 effort, and they had to rebuild things. And they weren't really thinking of movement. They said, okay, SB 562 failed, and they all disbanded. And I was just so surprised when I found these other groups had to rebuild themselves. They didn't have that thing. And so I comment on that. And the other point was inoculation. I totally agree, inoculation. I haven't been doing this for 30 years. I've been doing this for 6 years. But my feeling is all the work I've done on the federal and state bills have been more kind of go talk to the representatives, go put out this petition. And I don't feel we've really put in an effort on inoculating, right? Because you mentioned the polls too. And some of the polls say when they give the pros and cons, all of a sudden things just drop down. And they're just doing kind of objective pros and cons. They're not doing the Harry Louise sort of pros and cons. So it is very delicate that, like you're saying, that large support we have, we haven't been doing the inoculation of the larger public, I feel. And I don't know if you can comment on either of those points.
Well, I think you're, I agree with you, Bob. It's funny though, 2016, it was a real movement building time, right? A real movement building campaign. Of course, in 2020, we actually won the California primary, right? And so it's an interesting, right, distinction. We weren't able to beat Hillary Clinton in 2016. But nonetheless, your point is well taken, is that it takes both. We're either going to have to build it. To build and sustain a movement takes organization. Organizations build and sustain movements. Organizations carry on the fight in between the legislative initiatives, right? And it's organizations that move us, from a position into a position of being able to educate and inoculate. I think in California, it's going to take something even bigger. It's going to take a large amount of money that probably can only be accessed through these philanthropic foundations like the California Endowment. Imagine now they spend $100 million a year on healthy communities for 10 years, $1 billion over 10 years, and then saw these communities that they had been working in devastated by COVID. That is an indication that there is something fundamentally systemically wrong that has to be addressed. Imagine if they spent $50 or $100 million educating people on how single payer could transform healthcare in their communities. That's what I think really the level it's going to require. Maybe we get 10 million, maybe we get 5 million. But that's what it takes is building engaging the frontline organizations and communities across California, particularly communities of color, and doing what People's Action likes to call deep canvassing, the one-on-one conversations that get the issue to stick. And our former colleague, Don Beckler, was very persuasive on this point, where he really, we didn't have the infrastructure to do it, but his idea that you get a deep commitment from 5 million Californians that can't be moved by industry propaganda, that is the basis to win. And I think ultimately he was right that we're going to have to do those deep conversations one-on-one in communities in order to secure the inoculation and use the opportunity to move legislation and get the level of resources from entities that are supposedly committed to universal health care, but have been not fooling around, there have been some progress, but have been devoted to incremental changes that are not going to solve the systemic issues. So I think you're right on both counts. All right. Any other questions or comments? Mark Dudzik has offered to put up the PDF version of this presentation on the Labor Campaign for Single Payer website, so we'll get that out. He reminds us that Cindy's workshop on Off the Table, taking healthcare benefits off the table, will be very instructive to that. I think, we should be heartened by the Amazon labor union's victory. Notice how they achieved that victory. They embedded those organizers in the workplace. They were talking one-on-one to their coworkers, and the Amazon propaganda didn't work. Captive audience meetings didn't work because their colleagues, their coworkers were telling the truth. And the authenticity and power of that truth came through in those conversations. And that's really a model for us, I think. Kat?
Okay, hi. Yeah, I had a question regarding ballot measures to address incremental progress on covering more people, and if there's much history on attempted ballot measures to cover groups, for example, everybody under 18, or lowering the age to join Medicare down to 50 or something like that. Is there a history of that, or is there even a lot of polling data?
There is history, successful history, on ballot initiatives in red states expanding Medicaid. And I think virtually every time it's been on the ballot, it's passed. The legislature and the governor have undermined it in some states. But the Medicaid expansion ballot initiatives have been very successful, even in a place like Montana. So that is a good example of how I would argue, support for public guaranteed health care is what those ballot initiatives tap into. But it was understood that that was a population that was not well served by the system. If that were more broadly understood, that its system doesn't serve any of us well, it could be a parallel. But that's a very good example, Kat, on point of what you're talking about. The history in California with an incremental reform was SB 2, Proposition 72, which was essentially an employer mandate that employers would have to provide health benefits over a certain size. Schwarzenegger claimed to support it. He went back on his promise to do so, and it failed in a very close vote. Labor had spent a lot of money trying to pass Prop 72, and it failed by a close vote. So there's, I think there's some history on both sides, but the most recent history has been very favorable to Medicaid expansion. All right. Well, I think, yeah, go ahead, Kat.
Well, I was just going to say, what about polling data regarding Medicare for all children?
Right. There's definitely been support, but it's kind of encompassed by the reforms that were done. I mean, you've got the Children's Health Initiative program, CHIP. You've got Medi-Cal in the case of California expansion to cover kids. That's already in place. And so the kind of belief is there's not a lot there to do anymore, right? And that the programs that were established reflected support for that kind of thing. There's definitely support for, one of the most popular provisions of Build Back Better were lowering the Medicare eligibility age, to 55 or 50. That was very popular, in addition to, expanding benefits and getting rid of out-of-pocket costs. So popularity is definitely our strength, but it's not sufficient. And I think that at the state level, those kinds of age-based expansions are much harder to implement. And the truth is, when you look at like a reform like the public option, the industry ends up opposing that almost as strongly as they oppose single payer, because it means lowering their rates and regulating their rates and introducing, from our point of view, it just introduces more complexity, another plan that's going to, basically bail out the insurers. But ultimately, those incremental reforms end up getting fought as much by the industry. You saw that with the employer mandate, for example. That was a mandate to provide private insurance, and the employers spent tens of millions of dollars against it. So that's been our experience. Medicaid expansion was the exception. There wasn't a lot of opposition, of well-funded opposition to that, in part because the insurance companies were going to cover a lot of those people through the Medicaid program.
Okay. Yeah. I mean, the reason I ask is I've had a child who grew up on the Oregon Health Plan. There's the continual problem of reapplying, even though in the state of Oregon, there's only something like 2% of children who are effectively don't have coverage. The problem is there's a continual process of keeping people eligible to be on the plan. And of course, that creates a tremendous expense. So in the state of Oregon, just recently, the proposal has been for children under 6, once they qualify, they just stay on the plan until they turn 6 to save them from falling off the plan continually. It's a very small incremental step, but it makes a huge difference for families who are in that struggle point of keeping their kids enrolled. That's why I thought, I don't know if there are more incremental little steps like that we could be pushing through local ballot initiative that don't,
let me just stop you there, because we're out of time. But I think that's the kind of thing that we should be able to do through the legislature, probably. But I agree with you that would be very helpful. So look, I'm going to Bob, I got to cut it off now because we're at time. And really appreciate all of your engagement and your participation. Get this information out if it's helpful. And thank you again for coming today.